Dr. Lee received her doctorate degree in clinical psychology with a concentration in health psychology and interprofessional education from Pacific University. She completed an American Psychological Association accredited internship and postdoctoral fellowship at the Medical College of Wisconsin, where she specialized in psycho-oncology. Her skills emphasize evidence based approaches to support cancer patients in managing their symptoms and treatment side effects, promoting emotional well being in cancer treatment and survivorship, and improving outcomes during and after cancer treatment. She enjoys working closely with a team of multidisciplinary providers to deliver high quality, patient centered cancer care. And without further ado, I will turn this over to Dr. Michelle Lee. Thank you.
Hi, everyone. It's good to be here with you all this evening. Thanks again for spending this hour with me, and hopefully it's a valuable time to you. So I'll start with giving you an overview of what fear of cancer recurrence is. And the term fear of cancer recurrence refers to the fear, worry, or concern that a person that has been diagnosed with cancer experiences about the possibility that that cancer might return. It's often referred to by the acronym FCR. And because the term fear of cancer recurrence is a bit of a mouthful, I will refer to it by the acronym FCR at times throughout my talk tonight. The fear of cancer recurrence is really a process that starts at initial cancer diagnosis, but often people feel it most strongly. It often heightens at the end of their active treatments. So as people transition from their active treatments into cancer surveillance. And we also know that fear of cancer recurrence is very, very common. So depending on how it's measured, studies often report that it is experienced by over 90% of cancer survivors. And it's experienced by people of all different cancer types, all different cancer stages, and can even be experienced by loved ones, someone close to the person who has been diagnosed with cancer. And something I really emphasize anytime I talk about fear of cancer recurrence is that it is a normal response to a very difficult experience. And fear of cancer recurrence is really experienced across a spectrum. So one end is low or mild, and the other end is high. So people with low levels of fear of cancer recurrence, they can have occasional thoughts about cancer and sometimes even have peaks of anxiety. So those peaks can last a few days and then resolves. And that can be triggered, those peaks can be triggered by external factors. So maybe an appointment coming up, maybe they have a scan or imaging coming up, or even internal factors. So maybe they experience new physical symptoms that are unusual for them that causes them to worry that their cancer may have returned. And people with low or mild levels of fear of cancer recurrence are also able to manage those symptoms, those thoughts, those worries well with healthy coping skills. Whereas patients or people who experience higher levels of fear of cancer recurrence, they experience more frequent thoughts about cancer. So the thoughts are a lot more persistent and they can be harder to control. So when they have these thoughts about cancer, they can feel a lot of emotional distress. And because of the emotional upset that's brought on by these thoughts of cancer, it can make it really hard for them to cope effectively and cope in healthy ways. So sometimes this may look like avoidance, maybe missing or delaying or completely avoiding their medical appointments, for example. Or sometimes it can look like reassurance seeking. So maybe when they have a thought or a worry that comes up, they're looking things up online or sending a message to their oncologist to look for reassurance. And as you can imagine, in high levels, this can really impact your well-being and other activities as well. So it can impact their medical appointments, as I mentioned, and people with high levels of fear of cancer recurrence can also have a hard time planning for the future because it's hard for them to see the future as anything beyond the possibility that that cancer will come back. What studies show is that these folks who struggle with a higher level of fear of cancer recurrence, it is unlikely to decrease on its own with time. And so people really benefit from treatment. And in terms of prevalence, studies estimate that it's about 19% of cancer survivors who struggle with high levels of fear of cancer recurrence. And beyond the impact on quality of life, I also like to mention and make note of the fact that it can increase the risk that you experience other mental health concerns as well. So things like depression or anxiety. And I also want to emphasize that the level of fear of cancer recurrence somebody experiences is not necessarily associated with their actual risk of recurrence, right? So someone can have a low stage diagnosis, have a low risk of cancer recurrence, for example, not a very aggressive cancer, but a very high risk of it, and vice versa. And we know that coping skills are also effective at decreasing fear of cancer recurrence and decreasing the negative effects that it has on a person's life. So to understand fear of cancer recurrence, it really helps to understand how fear and anxiety work. So I'll give you a good overview of that. So let's start with fear. So fear is one of our basic core emotions. It's very powerful, as anybody who has felt strong fear can attest to. And it's also very, very unpleasant. And its job is to activate in cases of specific and immediate threats. And so usually it is short-lived, thank goodness, right? When it's so unpleasant and so powerful, and it resolves when the threat passes. So for example, I actually found this illustration when I was just looking for some way of illustrating fear. And there was a story of a woman, I think in California, who went on a trail run and encountered a bear. And so fear activates and our bodies really automatically, our nervous systems engage in this fear, in this fight or flight response. And that fight or flight response involves both mental and physical components. So mentally, our minds focus on that threat. We can have almost a tunnel vision on that threat. Our minds generate lots of negative thoughts and negative predictions. Our thoughts may move very, very quickly or race. And we're trying to identify quickly how to manage this threat. In terms of the physical components, this is part of also why it's so unpleasant. Our bodies are gearing up for quick action, right? So our muscles tense up, our heart rate and our blood pressure increase, our breathing gets rapid and shallow. And again, because it's so unpleasant, we want to get rid of it and we want to start to and get back to feeling comfortable. And that is how it motivates us to manage harm. So because it's so unpleasant and so uncomfortable, we want to get back to feeling comfortable and safe. And so let's say we manage to get away from this bear, right? We avoid the danger, we get off the trail, we're back home, and that threat passes. But because of that experience, that unpleasant, that fearful, that dangerous experience, we can then develop anxiety. So our fear response and our anxiety response is adaptive, right? It learns from our experience. So this may look like after we encounter that bear on that hike that first time, we might get nervous about going on other trails, right? So even other trails where we've never had this experience before. And that's really the way that anxiety works. So it activates our concern about a potential threat. And while fear tends to be short-lived, anxiety can be more ongoing and more persistent. And so in this way, anxiety works like an internal alarm system. It tells you if something might go wrong. So we often use the analogy that anxiety works a little bit like a smoke detector in your home. So it goes off when it detects any smoke, and because that smoke might mean a fire. And when it goes off, it's really loud and it's really annoying and it's really unpleasant, and it makes it impossible for you to comfortably enjoy your home, right? Watch TV, make dinner, sleep, and that motivates us. And we go and look for that fire, make sure that nothing is wrong. And this is especially true if we've experienced a fire before. So maybe if we've never experienced a fire, the smoke detector goes off and we're a little bit more relaxed about it and we go, oh gosh, what set that off? But after a house fire, we're much, much, much quicker to respond. And we do everything we can to turn that alarm back off so we can go back to feeling comfortable, at ease, and safe. And so in this way, actually, low levels of fear of cancer recurrence can be helpful. And it's helpful in a couple ways. One thing that it can help us do is it can motivate us to manage the cancer risk factors that we can control and do what we can to stay healthy. And so this can help us with sticking to an exercise routine or eating well, even when we are having a really stressful week, right? And take really good care of ourselves. It helps us to go to our medical appointments, even though the last thing we want to do is see more of the hospital. And another thing that low levels of fear of cancer recurrence can also do is it can help us better prioritize the things that help us feel we're living meaningful lives. And so cancer can send us this message, right, about how unpredictable life is and how unpredictable it can be. I myself, I know of many patients actually who have decided to quit their very stressful jobs in order to just rearrange the priorities in their lives and so that they can do the things that they really value with their time. The thing with cancer, though, is that anxiety around cancer is unique in many ways, right? And that also makes the fear of cancer recurrence unique in many ways. And so I'll walk you through some of these things, some of these unique aspects. One thing that makes fear of cancer recurrence unique is the amount of uncertainty that's involved in cancer. I often tell my patients that navigating a cancer diagnosis and navigating treatment can feel a bit like a game of odds, right? So there's the odds that your cancer was detected in the first place, that the diagnosis was accurate, that your cancer will respond to the treatment that your oncologist recommends based on the research that's available at that time. And your treatment team's goal is to improve your odds. So they're doing everything they can to stack those odds in that positive direction so that they get you as close as possible to a certain positive outcome with your treatments and keep you there for as long as possible, cancer-free for as long as possible. But there is no guarantee in cancer with any treatment or any lifestyle change. And so psychologically, this is really hard to cope with because all the uncertainties stack up on one another. And our brains experience the unknown as dangerous. And so that in itself makes us afraid and it activates our fear and our threat response and causes us to worry. Another aspect that's unique is that often there's not a specific endpoint to cancer treatment or the diagnosis. So what I mean by this is most people, most of the patients I've met with can tell me down to the moment, not just the day, the moment that they got their cancer diagnosis. So before they realized they had cancer, the day before that, where they were living their carefree lives and had no idea that this was occurring, and a day where they felt very, very clearly, oh, this is happening, right? My life is changing. And so in contrast to the beginning of the journey, often the end of the journey is not so clearly defined. Really often cancer treatments look like these milestones where maybe you had surgery or chemotherapy and radiation, and maybe you got to ring a bell at the end. But very often, instead of one clear finish line where you felt the strong relief of, phew, the challenge of cancer is over and it's behind me, most of the cancer patients I've met with and have worked with describe to me these milestones that kind of get further and further apart as they move through their treatments and complete them. And those milestones signify, okay, this experience, this hard experience is more and more in my background, further and further behind me. And that helps them to feel safer and safer over time. But it's a real contrast, right, to how dramatic that beginning of treatment is. And that's also really tough for our nervous systems. We like having clear, tangible evidence that the thing that threatened our survival is truly gone, right? So we can look and we can check and make sure that bear is no longer anywhere near us, but that kind of clear confirmation isn't always part of the cancer experience. The other unique thing about cancer is that there are so many reminders about cancer. This is a screenshot of just some news stories about cancer on a day that I was preparing for this talk. And I think you can see from this quick snapshot everything from new advancements in cancer research to, a story of somebody who's been affected by cancer. And it can often feel really impossible, right, to go a week even without seeing a commercial or a news story about cancer. And I also know that for many of you, you may be the go-to person that gets told about everybody in your life and all their loved ones when they get diagnosed with cancer. And so you end up hearing maybe even a lot more of these stories than you ever did before. And so all these reminders can also make it really challenging to emotionally recover from the cancer experience. And so to go back to my bear and that trail run analogy, you can avoid going back on that same trail where you saw that bear and still have plenty of other trails and hikes to choose from, but it is really difficult and often really costly if you try to avoid reminders of cancer. The other, and actually this is the last point I'll make about one of these unique aspects about cancer, is the way that surveillance itself sends a little bit of a mixed message about cancer. So not only are the medical visits another reminder of the cancer experience, but they also can make you feel like the cancer is lurking because it feels maybe like your doctor is expecting that your cancer could come back. And so these follow-up visits are trying to strike a balance, right, of maybe detecting the cancer as early as possible if it does return, but also recognizing that these are emotionally difficult experiences to have, to go back to the places where maybe you had some difficult memories with your treatments, and again, to just have this reminder that cancer is carrying forward with you beyond your active treatments. And so with all of these unique aspects and all these, the factors that contribute to the emotional experience of going through cancer, I think it becomes pretty clear there's not an easy or a healthy way to avoid at least experiencing a low level of worry or concern that your cancer might come back. But the goal ends up being managing that fear and anxiety as well as we can. So how do we do that? This takes us to the practical tools portion of my talk. And in kind of this next, and this will carry through towards the end of my time today, I'm going to walk you through some of my favorite tools in the toolbox that I have when I work with patients on managing fear of cancer recurrence. So my first recommendation is to try to decrease the uncertainties that you have around cancer as much as possible. We can't decrease them all, we can't eliminate all the uncertainties, but we want to manage the uncertainties we can. Typically, this looks like gathering information from your cancer treatment team about your specific situation. So this often looks like a conversation with your oncologist where you ask them what your prognosis is, and including also the basis for that prognosis, right? So what does the research say? And the likelihood of a cancer recurrence for you. Also to look for and to understand what the signs and symptoms are of a recurrence for you. And something I recommend is asking, how serious do these symptoms need to be? How long do they need to be present for before you need me to let you know, right? And who do I contact if I start to develop these symptoms? And then also asking the question, how can I reduce my risk of recurrence? So what are the risk factors that are within my control? And this also involves what's this plan for follow-up and surveillance. What I recommend is putting this list somewhere you can access quickly. My typical recommendation is use a note on your phone. And so what you can utilize this note for is that when your internal smoke detector goes off and you have thoughts about cancer, you start having worries, maybe you start developing some physical symptoms, you can check those worries against this information that you've gotten from your oncologist to see if it warrants a certain kind of response. The second recommendation I have is to remind yourself that thoughts are just thoughts. So I'll walk you through what I mean by this. So when our thoughts are generally accurate and generally helpful to us, we get into a habit of treating our thoughts as generally reliable facts. So these are suggestions that we can count on that are typically really good at helping us navigate our world. And often our thoughts kind of go a little bit unnoticed by us, right? These are just directions we kind of take and we don't question. The issue is that when we get diagnosed with cancer, we think a lot about it. We may pay closer attention to our bodies, think more about our bodies than we ever did before. Cancer treatment really demands this of you. You have to track what's happening for you physically and report that to your team. And you do a lot of thinking about cancer. You do a lot of trying to understand cancer, trying to predict what's going to happen. And also because it's scary and stressful, it's often the case that we also think more negative thoughts in general, and we make more negative predictions in general. And really often these thoughts continue even after the active treatment is complete. Like I said, no defined endpoint. And so the mind sometimes struggles to make that connection. I'm back in daily life. And so the mind can continue to think very, very frequently about cancer. So usually when I say this, my patients say, really? I'm stuck with these thoughts forever? Is this just what I'm going to think about? I'm going to think about cancer all the time. And I feel a little bit like the bearer of bad news. And, we work on processing that grief together. And something I often say to my patients is that you can think of this as one of those changes that you experience after your diagnosis or after your treatment. So for example, maybe that person, you maybe have more fatigue and maybe you need like a 15-minute power nap in the middle of the afternoon to get you through the evening. You can think of having thoughts about cancer as one of those ways that life is different than it used to be. Some suggestions. Oh, I forgot to mention, if you see this little icon of a person holding a light bulb at the top right-hand corner of the screen, that means I've got some practical tools coming up. Um, and so what do we do? How do we manage these thoughts about cancer? So when you have thoughts about cancer, like for example, an anxious thought, like maybe your cancer has come back, I recommend reminding yourself that one, it is very, very normal to have thoughts about cancer. It is a normal response to a difficult experience. You haven't failed in some way because you're thinking about it again, even though treatment was over many months ago. It is a normal reaction and a normal response. You can also remind yourself that thoughts are just your mind's best guess at what you need based on what you've experienced. These are just suggestions, ideas, images, words that float through your minds. And that even when the thoughts feel very convincing, thoughts are not always helpful. So they're not always what we need to live meaningful or good lives. And thoughts are also not always accurate. So that smoke detector sometimes goes off without it signaling any real fire. And anticipating danger does not always mean that that danger is present. So it can be really helpful to use imagery or visualization to help us remember, right, that are just thoughts. Because like I said, we get into that habit of treating them as generally good, accurate information. So one visualization I like is to picture the mind as a backseat driver. So it's always telling us what to look out for, what direction to take. There are suggestions that are sometimes true, sometimes helpful, not always, sometimes even contradictory. Right? And there is actually another part of us that can observe this, that can observe all the directions we get, all the suggestions we're hearing, all the questions we're hearing. And we can notice that our minds sometimes give us these directions that sometimes even contradict one another. And that part of us that can observe it all happening is also the part of us that's sitting in the driver's seat, right? Two hands on the wheel, that's able to take directions, take actions, and make decisions. And that part of us that's in the driver's seat needs to have this good perspective, not only of the suggestions that's coming in the back seat from the backseat driver, but also what's ahead. Where are we trying to go? What are our goals? What are our priorities? What's our situation? In order to make really good decisions about how to navigate the road ahead. Another visualization I like is to picture an internet search engine. So, something like Google, for example, that gives you suggestions based on your past searches. So I don't know if this is true for everybody's Google, but this is a screenshot from my own search engine. And so when I type in the letter C, it suggests cancer because I spend a lot of time reading about cancer. And so you can also remind yourself that your mind works in a very similar way. So after cancer diagnosis, after a cancer treatment, when you've thought about cancer many, many days, most days for months and months, the search engine of your mind is quick to suggest searching for or thinking of cancer. Another visualization you can use is to picture your thoughts as clouds drifting across the sky. So especially if it's a fear-provoking thought, this is a helpful one. And you can just, think about laying on a sunny day, watching the clouds past, just coming and going on their own, something we can observe neutrally without needing to act or respond. And so why is this helpful to do? Right? So why observe our thoughts from a place of observation, from neutrality, rather than reaction? So aside from the fact that our thoughts are not always helpful and not always accurate, often the things that we try to do to make a thought go away is worse than the thought itself. So this can look like, for example, distraction. Maybe you stay busy all day and so you don't think about cancer, but then the nighttime comes and you're alone and things slow down and the anxiety just builds. Or avoidance, like I mentioned, we don't go to our doctor's appointments or we delay them or we ignore new symptoms that we notice. Or I've even heard from patients who try not to watch new TV shows until they know that there's not a storyline about cancer in there. Or they might put down a book that they were really enjoying because a character in it develops cancer, for example. You might even avoid family members because there's a certain family member who always asks you about how you're doing with your health, for example. Or this can also look like reassurance seeking. So maybe we ask for additional tests with our oncologist, or we look a lot of things up when we think about cancer just to try to make that fear go away. And then when the attempts fail and those negative thoughts come back, we tend to feel like we failed and we feel worse about ourselves. So I love this image of trying to push a beach ball underwater. And then when it comes up to the surface, we feel like we failed. And I think we kind of can picture how effortful that is to do. And so with time and practice, we can get better at coexisting with our thoughts, even the ones that make us uncomfortable, without spending our time and energy trying to make them go away. And again, especially when the thoughts are a normal response to a difficult situation. And I've included here a couple of links that you can refer to when you have a copy of the slides later after our talk today, or my talk today. And you can do a little bit of further reading if you're interested. So as I mentioned, not all of our cancer thoughts are helpful or accurate, but some are, and it can be difficult to tell those thoughts apart, which ones are helpful, which ones are accurate. My recommendation for this is another list. So I actually suggest keeping an ongoing list of questions, observations, maybe even advice you've gotten from friends and family, things you've seen online, and it can be a log where you get to jot things down as they come up. So especially if you struggle with looking things up quickly when you notice something concerning or sending a message or having a quick reaction to it, it can further reinforce that feedback loop that makes you think, okay, every cancer-related thought is dangerous and I need to act quickly and immediately. And so instead, doing something like this, where you maintain a list, can reduce that reactivity. And that can help you engage in the thoughts in a way that isn't fear-based or reactive, but allows you to be a little bit more of a clear thinker. So you get to say, thank you, backseat driver, for that suggestion. I'll think that over. Right? And over time, that helps you build an emotional relationship with that fear of cancer where you feel a bit more empowered and more connected to the things that you can control. If you notice serious symptoms, of course, anything that can be a sign of a medical emergency, get immediate medical attention. And I actually encourage asking your oncologist for guidance on how to tell these things apart. So something I say often to my patients is don't triage this yourself. Your team is there to support you. The other thing I will acknowledge, I recognize though, that, even though the thoughts are not helpful and the thoughts are not accurate, they can still bring up these strong emotions. And so the next set of slides will walk you through how to manage those difficult emotions that are associated or connected with cancer. So one thing that you can do to get better at handling these difficult emotions that are tied to cancer is to learn to observe and to get to know your emotions. So we can't manage what we don't know. And there's a saying in psychology of name it to tame it. And it speaks to the importance of identifying and labeling your emotions as a first step if you're trying to get a handle on them. You can use a tool like this emotion wheel, and you can just look that term up, emotion wheel. This is my favorite one. I think it comes from the Calm app. And it helps you get better at finding words that match your emotions exactly, right? So the way that the wheel works is that it has some general terms in the middle, and then as you move outside of the wheel and towards the outside of the wheel, it gives you more specific words. You can also rate the intensity of your emotion. So just, picking a number from 1 to 10. You can try to find that emotion in your body where you feel it the most. And we actually have a lot of language that, kind of signals this, right? How much we feel our emotions in our bodies. So things like a lump in your throat or a knot in your stomach. And over time, this helps you build that skill of emotional awareness. It also helps you tolerate your difficult emotions better and can help you regulate them better. So this is a great first step. You can also practice observing your emotions as they change throughout the day. So paying attention day to day, noticing what seems to influence your emotions, what activities, what environments, what times of day, where you find yourself happiest or maybe struggling with more difficult emotions. This is helpful because when we're caught up in unpleasant thoughts or emotions, we often feel like they're going to last forever. That's part of what's so unpleasant about them. And then when we're feeling good, we tend not to notice because we're just enjoying the moment. And so it can feel like the difficult thoughts and emotions, maybe dominate the day, when actually over the course of the day, you felt a whole bunch of different things at various times. And so when you watch your emotions change over the course of the day, you get better at recognizing that all emotions come and go. It can help you hold those difficult thoughts, those difficult emotions more lightly, knowing they don't last forever, and that isn't always how we see things. And then also when the positive moments are there, it can help you really soak it in and enjoy it. And this practice of observation can also help us to know what to do. So when we know what really seems to influence our emotions, we know how to help ourselves feel better when we need it. And then there's also the skills for emotion regulation, which is how you influence your emotions. So there's a set of skills that can help you decrease the intensity of your difficult emotions. So I've listed a couple here: diaphragmatic breathing and progressive muscle relaxation. Those are especially good for managing fear. And so I really recommend those. You can look those up, many resources online for helping you with those. And then also practicing the thoughts are just thoughts, because sometimes our emotions are brought on by those thoughts that are difficult and distressing for us. There are also good skills for helping us boost positive emotions. So one of these skills is what's called opposite action, which is where you want to do the activity that you tend to do when you feel the opposite of that difficult emotion you're experiencing. So maybe you're feeling embarrassed or afraid and you want to withdraw and isolate from other people. And so opposite action tells you, let's do the opposite emotion, what you would typically do when you're feeling maybe more brave or more courageous or more confident. And that can help you connect with people in those moments and can actually help you with generating those positive emotions that you want. We also can learn the skill of coping self-talk. So this is learning how to speak to yourself in a way that is genuine, validating, and also encouraging and kind, because many of us struggle with self-critical self-talk when we're struggling with a difficult emotion. Another recommendation I have for dealing with difficult emotion is to look underneath that emotion and get to the meaning of it. So all of our emotions signal meaning. They work by telling us what matters to us. And there's another saying in the mental health world, we hurt where we care. And this refers to how when we look at the things that keep us up at night, the stuff that weighs heavy on us, that we really feel deeply and feel afraid for or sad for, they tend to be the things that matter the most to us on a deep level. So it tends to be things like family and our friends, our home. And so when we look closely, a lot of the emotional pain we experience points directly to what's important to us. And so if you remind yourself that our emotions hold meaning and that when we're afraid, for example, it's our nervous system's way of helping us protect what's important to us, it can help us befriend those emotions and tolerate them better. The last skill I'll mention here for handling difficult emotions is the skill of self-compassion. Self-compassion refers to our ability to treat ourselves with the same kind of kindness and the same kind of understanding that we typically offer our dear friends, especially in moments of difficulty. The research is very consistent in terms of the link between self-compassion and positive mental health, and this is also true for cancer patients and cancer survivors. It also seems that practicing self-compassion can help to buffer our mental health. So it can help to protect us from developing mental health concerns like depression and anxiety, even PTSD in difficult times. Research also shows that we can develop the skill. So it's not like it's just something you get to have or you don't have. It's something that all of us can get better at. And so there are a few components of self-compassion that I'll highlight here. One is recognizing when we're being unkind or overly harsh to ourselves. So often this is automatic, it goes unnoticed for us because it's so habitual, but it's learning to catch those thoughts when they're happening. Another component is offering ourselves comfort. So giving ourselves that kind of soothing when we're having a hard time that we need. The other is common humanity, where we remind ourselves that we're human, that we're struggling with the same kinds of things other people struggle with. And that can help us feel less alone in really tough times and can also help us be kinder to ourselves in tough times. And it also involves action. So it's actually a misconception. Sometimes when I bring up self-compassion, people say, oh, I'll just cut myself slack all the time then. And actually, self-compassion is the opposite of that. It can help us with holding ourselves accountable to the things that could be helpful for us. And so if you're asking yourself, how do I do this though? I will have resources at the end of my talk today, some of my favorite resources for developing the skill of self-compassion, because I recognize this is a tough one for practicing this for ourselves. My next recommendation is to manage the other stressors in your life. So we don't get a separate nervous system, right, for our cancer-related fears and stress, and then a separate one for family, and then a separate one for work. Unfortunately, all of our stress weighs on the same emotional alarm system. And the research supports this. So when people have higher stress associated with their family, they also tend to struggle with higher levels of fear of cancer recurrence. And so stress management can look like a lot of different things. So sometimes this can look like lifestyle changes, maybe just making some changes in the way that your life is organized and prioritized in order to decrease your workload, decrease your stress, support your well-being. This can look like boundaries, so setting boundaries, maintaining those boundaries. And I also think it's important to remember that change is hard and it takes time. I find sometimes when we see a problem and we can't unsee it, we get hard on ourselves about making those changes quickly. We know what we want, why isn't it happening yet? And actually change is just difficult. So if you find you struggle, you know the kind of changes you want to make, but it's hard for you to actually implement and make that happen. It can be helpful to work with a professional to help you do this. The other thing with stress management is to not neglect the basics. So often the basics are the first things that go in times of stress. We have a hard week and we stop sleeping well, we stop eating well, we stop seeing people, we stop exercising. But these are the pillars, right? These are the things that help us maintain that basic level of safety and well-being. And so in times of stress, I recommend protecting your sleep routine. So your sleep will likely not be perfect, and that's okay. Our goal is to just create the conditions for the most optimal sleep we can get at the time, and our bodies will take it from there. I recommend eating well-rounded meals on a regular basis, even in stressful times. Keep moving your body, some kind of physical activity, even if it's not as great as usual. Some physical activity is better than none. Staying connected with other people is also helpful, both seeking support and receiving that support, and also giving that support. It really buffers our experience of stress. And also keep doing the things that you do just for fun, that help you feel like yourself, that help you feel like life is good for you. Another piece of managing this fear of cancer recurrence has a lot to do with the way that our minds process information. So our minds tend to prioritize negative aspects of our experience most. And this has the purpose of keeping us alert and aware of anything that could harm us, but it, of course, also makes it really hard for us to feel well. And so if it is hard for you to feel any emotion other than fear or these strong, difficult, negative emotions when you think of cancer, I encourage you to reflect on your cancer experiences more fully, and particularly on the ways that cancer has changed your life for the better. And I want to make clear, I'm not coming at this from a toxic positivity perspective where I think we need to, put a smiley face sticker on everything. That is not the case. But I say this because humans have this ability to also grow from difficult and traumatic experiences. This is called post-traumatic growth. We talk about post-traumatic stress or PTSD a lot, but there's also this concept of post-traumatic growth, and humans are just as capable of this. And it actually makes us more resilient to stressors in the future. The research really shows this around fear of cancer recurrence. So when people have more positive or a more meaning-based perception of their cancer experience, they tend to have a lower level of fear of cancer recurrence. The points that are listed up here on the slide are the domains that are typical for post-traumatic growth. And this is not specific to cancer. This is true for other difficult experiences we've been through as well. So for personal strength, for example, maybe you find that you doubt yourself less when you're facing a different challenge after your cancer diagnosis or treatments, for example. And so these are some of those typical domains. This is a slide I'll recommend for you to return to if this is something that you're interested in developing and seeing a fuller picture of. But these can be used as journaling prompts. So a lot of these questions are framed in a do you, don't you, but I encourage you, of course, go deeper. Right? And it can help you to think more deeply about your cancer experiences, go beyond the negatives that usually take up your attention. And so that when cancer, the thought of cancer comes back, or the memories of your experience with cancer comes back, hopefully it helps you generate some thoughts that aren't all negative, aren't all fearful, but some that also feel meaningful. The research also shows when people struggle with physical symptoms associated with their cancer diagnosis or their cancer treatments, things like pain, fatigue, lymphedema, they tend to struggle with a higher level of fear of cancer recurrence. And this, to me, this makes sense. All these physical symptoms are continued reminders of that difficult cancer experience and can bring up those negative emotions. And if you really struggle with these symptoms, they can come up every day. And so for those of you who still have persisting symptoms or functional impairments from your cancer diagnosis or from your cancer treatments, I recommend talking to your oncologist about these symptoms. As more people survive cancer and live longer after their diagnosis and after their treatments, there's more research being done and on interventions to help support quality of life and really manage these physical symptoms. So hopefully this is something we just get better and better at as we move forward in cancer care. And as I mentioned earlier, there are a lot of uncertainties in cancer. And beyond just the big unknowns, there's a lot of waiting in cancer. So what do we do with all the uncertainties? So I recommend using all those strategies I mentioned earlier about managing the thoughts you have about cancer and the emotions that are tied to cancer. And also when you find yourself struggling with uncertainties, I recommend a couple things. And it really involves focusing on the things that tend to stay true even in uncertain times. So one is the present moment. So when you find yourself considering all the possibilities, worrying about the uncertainties, you can practice redirecting your attention to just the here and now, not what will be or what could be, but just to the present moment. This helps in a few ways. So one thing it helps with is it helps your mind to recognize, I'm not standing in front of a bear, right? I am here, I am safe, I am calm, I am thinking about it. I am thinking about something that is anxiety and fear provoking, but right now in this moment, I am safe. And that can help to turn down that alarm response. It also can help us shift our attention to a little bit more of the immediate future, not the distant future, not what's going to happen in a week or 2 weeks, or when that scan comes back, right? But just to this hour, this moment, this day. And that tends to generate for us, open up a few more things that are within our control. So a few things that this can look like, it can look like just noticing yourself breathing. And so this can be just finding where you can feel your breath in your body. Maybe that's the rise and fall of your belly as you breathe, or feeling the air moving in and out of your nose. It can also look at like checking in with your five senses. So taking a moment to just go through what you can see, what you can hear, what you can touch, what you can feel, or what you can taste. And this will involve a lot of redirection, right? So your mind wants to go to the uncertainties because the uncertainties are dangerous and scary, and that's what our minds are designed to do. But our goal is to just bring it back to the present when it wanders, and we've noticed it struggling with this unknowns. I really like this illustration because of that, because I think it really rings true. We have to learn. It's not something that comes naturally to us, how to be in the moment, and then how to be in the moment after that. Another thing that typically stays certain and stays the same even in times of uncertainty is the stuff that matters most to you. So typically the things we find the most important in our lives that are core to who we are at our best stays the same even when we're in challenging times. Often a hint to this is the hopes that we have for treatment. So for example, if your hope for treatment is to live long enough to celebrate milestones with your family, that's a good indicator that you find family important to you. So I encourage you to reflect on what those values are for you. What are those things that you find core to who you are, that's the direction you want life to take? And in times of uncertainty, thinking about how do I stay connected to these things? How do I keep moving forward in a direction that is meaningful to me, even during this time when I'm dealing with a big unknown? Aside from the here and now and our values and commitments, it also really helps us to manage the things within our control. So stay on top of the things that you can do to manage your risk of cancer recurrence. And that can really help you with feeling a little more empowered. When we're struggling with uncertainty, we tend to feel really helpless about it. There's something in the great distant future that could happen, but might not happen. And we just really feel like we have nothing that we can do to manage that. And so reminding ourselves, okay, maybe I can't predict or I can't directly influence that outcome, but I can do certain things now in order to help myself moving forward. So we can talk also about scanxiety, which is the anxiety that we feel before a scan, before some kind of test that gives us a sense of what the cancer is doing, if the cancer is back. And we can actually use this opportunity to put together all the skills that I've walked you through today. So with scanxiety, one, reminding yourself that it is normal to have thoughts about cancer, that cancer thoughts come and go, and that it is normal for them to increase before these scans, before these big reminders, and that you haven't failed just because you're thinking about cancer or you're worrying about it potentially returning. And you can use this coping self-talk. This is something I teach my patients, is you can say, this is my mind's way of helping me after everything I've been through. Reminding yourself thoughts are just thoughts, that smoke does not always mean fire, that thinking about cancer does not always mean that that cancer is back. You want to reduce other stressors if you can. So one, keep up your self-care, those stress management basics. Sometimes I also recommend deferring any big decisions or other stressful things around those big appointments. So if you find you struggle with that annual scan or that every 6-month scan, I think it makes a lot of sense, if you can, to clear a little bit of time around that scan. So you're not dealing with a big work deadline, as much as possible. Because as I mentioned, you get the one nervous system for all the different stress that you manage in your life. And so anything that we can do to lighten that load can be helpful. This isn't always possible, but when you can, it's helpful. You want to practice your emotion regulation strategies to try to keep those intense, difficult emotions in check. And that can mean relaxation strategies, practicing self-compassion, continuing to do the things that help you feel good and help you feel like your best self. Focusing on the things that you know for sure. So the here and now and the present moment, continuing to enact your values. And because fear is sometimes paralyzing, it also feels good to take action. So this can look like preparing for your appointment, for example. So maybe reviewing that note that you've kept over the course of the last few months with your notes and your questions. Okay, if you're wondering if you should get more help, I have some factors that you can reflect on and consider to help you with that decision. So these are some indicators that you may benefit from more support. One is if you struggle with higher levels of fear of cancer recurrence. As I mentioned, lots of thoughts about it. They're very persistent. They're hard to manage. You find yourself managing them in ways that are not so healthy for you. And as I said, these high levels of fear of cancer recurrence is less likely to decrease on its own over time. And so treatment can really be helpful, and additional support can be helpful. If you struggle with feeling helpless about cancer, about your ability to manage cancer or prevent a recurrence, or if you have very strong emotions associated with cancer and it's hard for you to cope in healthy ways, or if you have unresolved grief, so if you feel like you've lost a lot of things with cancer and you just have not processed that and you've not, come to terms with that, gotten a sense of closure around that, support can be helpful. And if you want some support around making changes, so you know the changes you want to make, but it's really hard to actually implement them and maintain them, then additional support can be helpful. And support can look like a few different things. So I'll walk you some ways that support can look. One form of support can look like individual therapy. So if you have a legacy oncologist and you want to work with me, I work with patients over 3 to 6 visits, and we can work on fear of cancer recurrence. This is a big part of what I do. I would say any given time, about 10–20% of the patients I'm working with, I'm actually actively working on fear of cancer recurrence. If you have a legacy oncologist, you can ask them for a referral. Individual therapy can also be helpful if you have other mental health conditions that are unrelated to cancer but are impacting your well-being. If you want to find a therapist to work on fear of cancer recurrence, maybe you don't have a legacy oncologist, or you recognize you've got other mental health pieces that are impacting your well-being beyond just cancer. These are some recommendations I have. So these modalities that are listed here are what research supports around fear of cancer recurrence treatments. So this is being studied every day. I'm getting, new articles to read every couple of months at least on different therapy approaches that are being developed and being studied for fear of cancer recurrence. So cognitive behavioral therapy is helpful. Also, the third wave CBT approaches, or third wave cognitive behavioral therapy approaches. So these are therapies like ACT, DBT, and MBCT. So I've listed the acronyms here because they're often referred to by the acronym. So I want to make sure I help you with your searching as much as possible. If you're already working with a therapist, you can talk to them about your fear of cancer recurrence. You can share these slides and this talk with them as well. Also, support groups. Research shows that when cancer survivors are connected to other cancer survivors and participate in support groups, that can also decrease their levels of fear of cancer recurrence. So I will close my talk today with this quote from a psychologist named Susan David. She said, "Life's beauty is inseparable from its fragility. We are young until we are not. We are healthy until a diagnosis brings us to our knees. The only certainty is uncertainty. Tough emotions are part of our contract with life. You don't get to have a meaningful career or raise a family or leave the world a better place without stress and discomfort. Discomfort is the price of admission to a meaningful life." And I think that pretty well captures what we've been talking about here. This slide and the next slide are a few resources that I often share with my patients that I really like. So these are books that I like, and some guided audios that I like for relaxation practices, for self-compassion practices. And you can refer back to these slides at a later time. And then these are websites that I like as well. So Kristen Neff is the leading researcher on self-compassion. And so she's a great resource. She maintains a very robust website with lots of different resources. And thank you for your time. I hope this has been of value to you.